Hello, this is going to be number 2 in a series of videos that I'm doing on the diabetic eye issues, diabetic eye problems. In the first video, I talked about some of those early changes that diabetics will notice with their vision, sometimes before they even know that they are diabetic. And I showed you a diagram, a poster of the anatomy of the eye, and showed you the crystalline lens uh, and the swelling that takes place uh, in that crystalline lens that causes vision to be blurry, and how that can improve um, as you get your blood sugar under control. And we're going to be talking about that same lens again because that's where cataracts develop. And this video is dedicated to cataracts and issues that diabetics have with cataract formation. And so let me show you the poster again. I'm going to try to keep any glare off of it here. But again, this is the lens. It's probably, for those of you that haven't seen the first video, it might be helpful to watch that first and then come watch this one. This is the second in a series of eye-related videos. This lens right here is where cataracts are formed. It's a clouding of this lens where it's no longer just a clear media for you to look through and to focus light into your eyes. A lot of times it begins to kind of yellow or brown and then eventually become milky white and becomes very difficult to see through. It usually happens so gradually that people don't really notice it that much. And but at any rate, diabetics do have some issues with cataracts. Now, it's true that non-diabetics get cataracts too. That's absolutely true. You may be thinking that, well, I've got several relatives who are not diabetics and they got cataracts and had them removed and they did just fine. That's true. Cataracts are not just a problem for diabetics, but diabetics quite often will get cataracts at a younger age than non-diabetics, and then also diabetics sometimes don't do quite as well with the surgery as non-diabetics. The possibility of complications from the surgery can be a little greater for diabetics than for non-diabetics. And so that's another reason. I mean, there are plenty of reasons outside of the eyes to get your blood sugar under control and keep it as stable as you possibly can. But this is just another reason. If you don't, you may get cataracts at a young. If your blood sugar is way out of control, you may get cataracts at a younger age, and then when you have to have cataract surgery done to remove the cataract, you may not do as well as you would if you kept your blood sugar under good stable control. And another factor with cataracts is they are a part of the normal aging process. And for years, I've been doing eye care for 39 years. For years, when patients would say, "Oh, my dad got cataracts, and does that mean I'm going to get them?" And my first question was, "Well, how long did your dad live? And if you live as long as he did, you probably will get cataracts." And we used to joke too that if you live long enough, you will get cataracts, because cataracts are part of the aging process. But naturally, no one wants to speed the aging process anywhere in their body. And unfortunately, diabetes can do that where cataracts are concerned. Diabetics do have a tendency to get not in every person. Nothing is absolute in every person, but on average, diabetics will get cataracts at a younger age than non-diabetics. That includes type 1 and type 2 diabetics. I mainly focus on type 2 diabetes. Um, and there's a type of cataract that type 1 diabetics can get at a pretty young age, and it's called snowflake cataracts, but I'm not going to go into that in detail. I'm going to stick to type 2 diabetes and, just again, really emphasize the importance of uh, keeping your blood sugar under control so that you don't speed these aging processes. And that's what a cataract is part of an aging process. You don't want to speed the aging process in your eyes or anywhere else in your body. And let me give you an example. For a non-diabetic, it wouldn't be unusual to get a cataract in their 80s, say at 82 or whatever. Chances are that 82-year-old is going to be retired already and may not be, because they're retired, they may not be driving very much, not driving on a daily basis. And while if they're in otherwise good health and still fairly active and still wanting to drive, although they don't have to drive to work every day, if they still want to be able to drive and everything, they're going to probably want to get the cataract surgery done. Now, contrast that with a diabetic that gets cataracts in their 50s or early 60s and is still actively employed and needs to be able to drive to work every day. They can't, they can't put off having cataract surgery done the way that 82-year-old would put it off. That 58-year-old or 62-year-old with cataracts, if their vision drops to a level where they can't get their driver's license renewed, then they really need to have cataract surgery done, and their blood sugar better be under pretty good control when they have the cataract surgery done, or they run the risk of more complications, during the surgery and even following the surgery. So there's definitely good reasons to keep your blood sugar controlled the best you possibly can. And of course, my whole emphasis is to try to do that as much as possible without medication or with a minimum of medication. Many diabetics start out when they're first diagnosed with a small dose of metformin, and then over the years, things just get progressively worse and they end up on insulin and all that. How much better would it be if they could, by controlling their diet, keep on that small starter dose of metformin that they first started out with, or perhaps even be able to eliminate the medication in consultation with their physician that's prescribing for them? That would be a much more ideal situation. And then when that person that's really controlling things with their diet, and keeping the diabetes from progressing so quickly, they'll have a much better outcome when they do have to have cataract surgery at whatever age, and a better chance that they might not get cataracts at 58 or 62. They might get it at 78 or 82 like the non-diabetics. And that's the goal, is to make diabetics follow a pattern more like what non-diabetics follow, rather than being at a disadvantage. And again, this is video number 2 in a series that I'm guesstimating right now. It may run about 6 videos as we cover the different eye issues that diabetics can face. And this is a set of videos that it might help to watch in order. Certainly these first 2 would be good to watch in order. And so we'll finish for now on cataracts. If you have further questions about cataract surgery, let me just add, cataract surgery is a very common and very successful surgery these days. It's much better than it was 20 years ago or 30 years ago. Or cataract surgery today is very just incredibly improved. You normally don't spend a night in the hospital or anything. It's a day procedure. You go in, have it done, go home the same day. And so cataract surgery is nothing to really be afraid of. The only thing I caution diabetics about is to really have their blood sugar as stable as possible so that they don't run the risk of complications from the surgical procedure itself, because the surgery is very successful, very easy, very quick. But diabetics are a little more vulnerable of possible complications. And so just be aware of that. And we'll be working our way right through the eye. We're kind of at the front of the eye right now. Let me show you on the poster again. We're kind of at the front part of the eye talking about the lens. We're going to work our way back through the vitreous body. Before we leave the front of the eye, we're going to talk about glaucoma, and that'll be the next video, and it'll concern the front part of the eye, but then also damage that glaucoma causes in the back part of the eye, the retina. But we are, in this series of videos, going to work our way through the vitreous and back to the retina and the optic nerve. The optic nerve connects to the brain so that you can see and interpret what's coming into your eye. And so anyway, we'll end this video number 2 on eye-related problems from diabetes. And if you have more questions, let me know and put those in the comment section. And we'll see you in video number 3 when we'll attack glaucoma. Thank you. Live healthy, finish strong.